Hello and welcome to webinar series. Myself Shanti, and today's topic for discussion is all about not knowing the why causes harm. It is very important to everyone to understand the why behind everything we do, and it is the need of era. So, not knowing the why can lead to errors, and thereby patient safety will be always at risk. So, joining us in the discussion, I now invite Ms. Elizabeth Masih, our associate professor from Shri Shankaracharya College of Nursing from Bhilai, Chhattisgarh. And to tell a little bit about Bhilai city, it is the Bhilai is also known for its steel, plant and is a perfect blend of development and nature. I welcome you, Elizabeth.
Thank you very much, ma'am. I would like to express my heartfelt gratitude to the management of Association HUDCO, Shankaracharya HUDCO College, especially to Dr. Mrs. Monisha Sharma, ma'am. She is a director of our college. And thank you to the entire team of Yashoda Hospital for organizing such a great webinar. Special thanks to you, Shanti, ma'am. And
Thank you.
also, how can I forget Jansi, ma'am, who is the pioneer? I think because of her, we today we are connecting with each other.
Yes.
And thank you for your efforts of spreading awareness and providing a platform of knowledge among the students and sharing such a kind knowledge to the students. Thank you,
Yes,
ma'am.
indeed. Yeah, that's a great pleasure even for us as well. And going forward, we would like to have this first slide. Like our topic is not knowing the reason why. So understanding the why means, I mean, every nurse should be, bit curious, and they should also seek the reason behind an observation whenever they are in the clinical, they go to the clinical areas. Like I've just tried to quote few example, like why can't a patient eat soon after surgery? I mean, we see patients are NBM and they are just infused with IV fluids as well. But they should also, try to understand and find out the reason, because patients will be given anesthesia and GI system will be still not active and there will be potential vomiting and nausea. So, and at the same time, the very prevalent common condition in the ICU, whenever, we see nurses are busy or students are standing, they are monitoring the patients. But why is the monitor continuously alarming? They should always check the monitor rather going and just silencing the, switching off the button. I mean, the silencing the button, mute or something like that. Whether the patient is experiencing high heart rate or low heart rate, or patient is suddenly, desaturating, all that causes should be always ruled out. Then only the patient, the nurses will be, knowledgeable enough to just guide the right decision. Yeah, going forward, again, to Elizabeth, to you, do nurses realize that not knowing the why behind their actions can potentially cause harm to the patients? Yes.
Thank you, ma'am. I think yes, and I think sometimes no also, because these nurses are working in the clinical area, and many times they don't know that it can harm or it can be harmful procedure for the patients, because they don't know why they are doing that procedures. Generally, when we are going on the clinical round, we found that when we talk to the students, they are simply doing the procedures, and when we ask them which kind of IV fluids are you giving to the patients, and
Right.
what is the name of the patient, what is the diagnosis of the patient. They generally don't know about anything about the patient. They said that
Yes.
because of the sister in charges told us to do all these things, and they are doing the simple things without knowing the why behind their procedure.
So
So
they just follow the orders. They just
yes,
follow the orders just because it
exactly.
is asked to them.
Yes, ma'am. They are just following the orders, and they don't know why they are doing the exact procedure, why they are doing that procedure.
Yes. And sometimes when they know, they always, express and they feel confident. I guess, yes.
Yes, ma'am.
So again, going forward, is knowing the reason for why important for student nurses, because equally they are going to the clinicals. They are also, assigned the cases right from third year, fourth year. Yes. Yeah. Your take on the same?
Yes, ma'am. They should know the reason why. It is important for the student nurse, because it will help them to assess and clinical reasoning. Means when we are studying about the Nanda diagnosis tables, we will
Yes.
most of the time we are skipping that reason, scientific reason behind every procedure. So they should
Yes.
assess the patient properly, and they should know the clinical reasoning, that it will guide them to learn, and it will guide them to do the procedure in a right or correct way.
Right way. Yes.
It will
Yes.
also build their confidence, because while doing procedures, if they know the reason why they are doing the procedure, obviously they will get a confidence and they will do it correctly. And third
Yes.
thing, I would like to add that ensuring the safe patient care. If they know the
Yes.
reason and if they are confident with their care, they can do the patient care very safely, and they can protect themselves also, and they can protect patients also.
Yes. And so do they will disseminate the right teaching to the juniors as
Yes,
well.
ma'am. Yes,
Yes.
ma'am.
And yes, as we are going, further for the discussion, is building the why mindset. I know it is a little difficult to create the mindset or give this mindset scenario to among these Gen Z nurses. No, so is it the need of era? I mean, yes, what you get to notice, what you have your experience with along with your students, like, yeah,
Yes, ma'am. That is a must needed thing the nurses should have in this era, because
yeah,
student nurses should learn to think rational behind every care related to interventions, because they are doing it blindly. And if the in-charge sisters are asking them to do so and so procedures, they are doing that blindly, and they don't know the rationale behind it. For example, when we are administrating the IV fluids, so if we are administrating the IV fluid and we don't know that that patient is a cardiac patient, and if the IV
yes,
fluids drop is very fast, so it may cause seizures to the patient. So they don't know that what is the condition of the patient, and they are giving that fluid to the patient blindly, because they don't know the diagnosis of the patient. So don't blindly follow the procedure. Be responsible and be curious about why you are doing the particular procedure, I think.
yes, yes. So yeah, that this is the why connecting factors. I think everybody should understand why we even naturally why we are holding this kind of webinar.
Yes,
Just
ma'am.
because to raise the awareness among nursing fraternity, yes, and again going forward, and why nurses miss this why factor. It is not
Uh,
only nurses, everybody, every human or every individual. Why we
exactly.
miss, why we don't do our eye detail, task before we take over the patients. Yes, because
This is a
I think
very
you might be experiencing many of these scenarios because you're the faculty, you're the professor, you go for the rounds, you mentor your students. Yes.
this is very good question, ma'am. That why nurses are missing the why. When I talk to my some of the students about this question, why you are not asking the questions when teachers or when sisters are there in round. The first answer I got is that they are very fearful and they are not
Okay.
confident about their knowledge. So that's why
Yes.
they are very fearful and they don't want to ask questions to the senior authorities.
Yes.
I think right guidance are not there with them.
Yes.
I think because of just casual attitude that it is not
Yes.
my cup of tea.
Yes.
Means
Yes.
what will be possible if any harm causes to the patient, then it will be responsibility of the in charge sister and all that
Yes.
they are thinking. So
Yes.
fear of asking to the higher authority is the main factor I found. And next I found that lack of confidence, they don't have the
Yes.
confidence to ask because of the lack of knowledge may be the reason. And
Yes.
many times they are under work pressure, or they are very what I can say, they are very uh, under
They
pressure,
feel
or
nervous and they may say they don't feel responsible or accountable.
accountable for the.
Yes, the
Yes,
accountability doesn't just come maybe, yeah, they are just student. Even when
yes,
we were also students, we used to just come do our work, right? We were good in writing cardex, patient case studies, hardly we would do some patient bedside task and then go. I think
mhm.
that is how these students are experiencing as well.
Yes, ma'am. And
Yes,
lack of open communication is also
yes,
there. They are very fearful to ask to the senior in charges. So and they are also fearful to ask the doctors. They are also fearful to ask to repeat the instructions whatever they are being given. So that is the
yes.
main factors which the students are facing in the clinical area, and that's why they are not asking why I should do this procedure.
Yes. So going forward, we will also discuss how student nurses can overcome out of this fear and anxiety scenario in the clinicals. And Yes. How do we like this analyzing factor? I think when they know the rationale behind every procedure or every orders which has been given to them in terms of a patient care, I think one should always analyze and should be assessed. What is your point on the same?
Same, ma'am. I think you are very right with your points that they should always assess the patient. They should
Yes.
always analyze the patient and they should act confidently. And this confidence will come only when they will do a procedure again and again. The more
Yeah.
they
Practice.
will be practicing, the more confident they will be doing their procedure. And they should also use their critical thinking.
Yes.
This experience will boost their critical thinking. So, this point that critical thinking must be there among the patients.
So, yeah, so they can always handle the real-time patient challenges. Like if
Challenge.
at all a patient is admitted in the ward, they should assess whether patient is elderly and the patient may have a potency of fall.
Yes, ma'am.
So they must rightly assess, analyze, and they should give the educative factors also to the attenders so that they don't leave the patient and always the elderly patient to be escorted to the toilet so that hospital acquired is again big fatal potential risk which happens in many of the hospitals. So they should not be there. So yes, as rightly going forward, what happens when student nurses ask doubts during their clinical posting? I'm sure, as you said, they are little nervous, they are little fearful to ask or approach the senior nurses or the in charge nurses, even to the doctors. It happens. Firstly, first year, second year, they are all just little self-centric. They do not just approach the open communication. Then what is your, yeah, what is your mantra for the same? How do you motivate your students? Yeah.
We are very friendly with the students,
Yes.
and we prefer the language in which they are comfortable with us.
Comfortable. Yes.
Exactly, and we are pampering the students. बेटा ऐसा नहीं करते हैं, बेटा ऐसा करते हैं, like that. We are building a good relationship with the students so that they should be comfortable to ask any kind of question. Second thing, what we are doing in the clinical setup is that we are giving clinical instructors in each ward, allotted each wards, and they
Okay.
are over the time means the students are there in the clinical setups. Clinical instructors will be there available with them whenever they are facing any problem or they are facing any difficulty while doing any procedures. They can call this clinical instructors and they are guiding them. So they are under observation only and they are doing their procedures very promptly so that they can avoid the mistakes, and it will
Learning
boost
improves. Yeah.
their learning will be
Yes.
improved.
So when they go to the clinicals, do you have any induction session for them? Do you give them some pre-inductions before they go to the clinicals, or it is directly bedside?
No, ma'am. We are giving induction programs also whenever they are
Yes.
joining the college, or we are taking them to the clinical side. We are making them go into the wards. We are talking with the sister in charges, and we have two hospitals. So both of the
Okay.
hospitals, we are taking them. We are introducing with each and every procedures to the students, and then only
Okay.
we are sending them for the clinicals.
And they allowed to perform on the patients, real patients, the bedside procedures, let's say third year, fourth year, or under with the supervision with the in charge nurses and all. Let's say IV cannula and all.
Yes, ma'am. They are doing these
They
procedures
do.
under in-charge sister guidance.
Yes, yes, that's a very wonderful. And now, this is again one important question. How can we help student nurses so that they feel confident and they develop this, asking curiosity and they learn thereon? Yes,
So this is the answer for our why.
yes,
The big answer for this why is PBL, that is practice-based learning. The more
yes,
they practice bedside case, the more they will be confident, and it will give them a knowledge, and they will be doing that procedure very confidently. And when
yes,
they know the details, they are likely to make the errors. But I always ask my students that this is student time is the golden era. When you do the
yes,
mistake, no one will punish you or no one will ask you.
yes,
But after completing your education, when you are be responsible for any of the procedure, then you will think that our teachers always guided us. So I
Yes.
think students feel confident when they will practice bedside nursing. So more clinical should be there, and more practice based learning should be there for the students. We are taking
Yes.
them to the skill labs also.
Yes. So I think the culture of the reporting should be very great. I mean, if student does any mistake also, for example, because nobody does willingly the mistakes. If at all they have tried to do something wrong, also they should always notify the in charge nurse so that patient safety is not is taken care. There is no uneventful things which has happened. Yes.
Yes, ma'am.
And yes, as you said very rightly, bedside case based learning is very important. We urge and request all the nurses who are viewing this webinar, please, whenever you are posted in the clinicals, do read the case sheet. Take some notes out of that. If at all you have seen thrombocytopenia, what is the term called thrombocytopenia? It is again always a low level of platelet is known as thrombocytopenia. Just take down those notes, refer. I think millions of materials you'll get in Google, Dr. Google, we say. And again, come back to your clinicals, ask your tutors, ask your mentors, ask your in charges. I think that should be the great fundamental procedures or tips so that you can improve. And yes, again, when learning improves, I think yes, first year, second year, these learning curves keeps improving. Do our students acknowledge that their knowledge gaps,
Yes, they
their
are.
own knowledge gaps? Do they identify? Do they tell, yes, I was doing that wrong, I was not able to do proper technique, now I know I am doing and following the right method of practicing? Do they acknowledge? Do they tell? I'm sure nobody tells their own mistake. Sometimes they sometimes they say them, sometimes they learn. Yes.
Yes, ma'am. Many of our students acknowledge that they have some errors, so they are doing some mistakes. And obviously,
Yes.
while doing that procedures, they always ask their senior teachers that how to do that procedures. So they are filling the gaps, the knowledge gaps, and they are asking the questions. Uh, for that, what we are doing, we are always posting the junior student with the senior students, so that if they are not comfortable with our teachers to ask the questions, they will ask questions to their seniors, so that they will be
Seniors.
comfortable to ask the questions. So they are asking the questions.
Yes.
And
Yeah. Are we training nurses to ask the right questions? I think this is the real-time challenges which every college, schools, and of course, the curriculums are also has to be abided by. But then real-time students challenges also, I think you all take this little heat burden onto yourself. So yes, are we training nurses or nursing students to ask the right questions? Like yes,
yes, we are training nurses to ask the right questions. What we are doing is that after teaching the theory, we are taking to the stimulation lab, and we have high fidelity mannequins over there. We are making them practice on the mannequins so that they can be more confident and less error can occur. We also
yes,
give them OSCE, like skill based learning. We have our stations, and we are giving small procedures so that their critical thinking can be improved. And the most important thing is that daily bedside trials. So that is a
yes,
real case studies, like a scenario we are creating. We are making one of the student, one patient, and we are creating the scenario, and we are asking them to find out the case studies and to make the case studies and provide the care to the patient, not to the patient, to the student who is acting as a patient. So it will
yes.
boost their knowledge, and it will
Confidence
boost
and communication,
confidence and
yes. So do
communication.
you meant this role play and yes, role
Yes,
play
ma'am.
kind of scenario? Yes, yeah.
Yes.
And how do you acknowledge, Elizabeth, whenever you go to clinicals and you have these five BSc grads who are, in the ICU? How do you acknowledge? How do you validate that they are learning? Their learning curve is improving. A week ago they were not knowing, much information about or details about the patient. Now, after a week or after the fortnight, when you address them, they are learning. How do you validate? Do you have any, protocols? Yeah.
Yes, ma'am. We are maintaining the daily diary, and whenever they are doing any of the procedures wrong, we are giving repeat procedures to them, and they are repeating the procedures. And always we too are maintaining the diary so that we know the students name, what they are doing. And if we have
Yes.
given any repeated procedures to them, we are asking them to do that procedures. If not possible in the skill lab, if not possible in the clinical area, we will ask them to do in the skill lab. So by that way we are validating the students.
Yes. I think we have just come to the, by just continuously talking, we have not even realized the time, and we have come to the end of the discussion. And I would love to have this answer from you as well. Like, what is your mantra of motivation to all of our nurses, not only your Bhilai nurses, not only Yashoda nurses, to all our nurses across, what mantra we should follow? I know these girls are a little sensitive, these girls are, they need to be pampered, little flattering ideas to be told to them. At the same time, we need to be strictly, maintain the discipline so that it is always, benefiting them only. So what is your mantra you would like to, tell here? Yes.
My mantra is to proper guidance to the students, be friendly
Yes.
with the students, and be competent. Like if they are whichever language or whichever position they are comfortable to talk, we should ask them to talk. We should listen properly to each and every
Yes.
problems of the students,
Yes.
because when we choose to talk about why, I first ask them that what problem you are facing in the clinical area, so that I
Yes.
should solve your problem. So listening
Yes.
is very important for the students. We should always acknowledge our students, and the most important part is we should always praise our student. If they
Yes.
are asking questions, if they are saying something, we should always praise them in front of all other students, so that other get motivated and they can do their job properly. So
Yes.
praising student, I think, boost confidence more properly than the action they are taking.
And that keeps them going, go getter type, because
Yes, ma'am.
they again have to go right. And nowadays twice a year they got to clear the exams, so much of curriculum, heavy curriculums, I think. Yes. And at the same time we give them little protocols on the bedside. They are expected, because
Expected.
patient expectations are high in the complex healthcare system. Yes. And yes, we can talk more about this, but then the time is not able to permit us, and we are trying to end the session. I thank you, Elizabeth. I thank your management. I thank my team, as well. And you would like to, quote your message to the nursing viewers here. Over to you, and then we end the session.
Thank you, ma'am. The last quote, which I want to quote, is that the greatest harm is not the absence of knowledge. The greatest
Yes.
harm is not the absence of knowledge, but the absence of seeking it. We should always seek the knowledge, then only we
Speak.
can
Yeah.
boost the
Yes.
confidence. So thank you very much, ma'am, and thank to the Yashoda group for this chance.
Thank you so much, and we'll since we have connected, and we will continuously, wish to connect with you guys. And thank you. We end the session.